So this study was looking at older kids. So it's not exactly the first and second month of life, but it was a study nonetheless to look at 3 to 6 months old. So now we're shifting a little bit later into their early life. But we also designed this study to understand the effects of wash and lotion on the skin and the skin microbiome of infants of this age. So let's see what we saw in this study. So this design was to enroll about 40 subjects. It was difficult to enroll in this particular study, but we got about 20 in each group. In group 1, they used a mild infant wash and shampoo. And in group 2, they used a mild infant wash and shampoo, as well as the lotion. And so here we are able to look and compare how are the products interacting. Is the lotion providing an effect? Is the wash providing an effect? What's happening over time? So we'll look into that in this particular study, as well as looking at the fundamental aspect of the microbiome. The time points that we measured were baseline, 2-week treatment, 4-week treatment, and regression. So what we found were that both of the cleansing and emollient regimens were well tolerated. So they weren't causing any irritation or problems in the skin. The skin pH remained slightly acidic throughout the course of the study, so it was keeping the skin in a physiologically relevant pH range, so that was good. We saw hydration improving when you used the lotion, and it was worsened when you remove the lotion, as you would expect. So the lotion is hydrating the skin. We can see some of the delta of that in some of these assessments. And we'll think about that when we talk to the microbiome data and what we saw. And the caregiver assessment in particular showed improvement in skin softness. So again, we see these benefits for using these products. They're tolerated very well. They're not causing any problems, and the baby's skin remained healthy throughout the study. What happens when you look at the wash plus the lotion? So we know the microbiome diversity is stable over time. It's not changing over the 3 to 6 month period of life. When we add a lotion to the mix, does that change something? Sorry, is there a question? Okay. So the answer is no. Over time, what we're looking at is with the use of a wash and a lotion, no diversity changes over time. So these interventions are not altering the composition, the basic balance, if you will, of the microbiome in this infant's skin, as it relates to diversity. And you can see this here. In general, there are some differences and there are variability within each person. Each person's microbiome is unique and can be, very variable. So you see some of these changes, but none of these are significant over time. So if you look then next at what happens when you add the lotion to the mix, again, we see increases in richness at now 4 weeks in regression. But we did both in this study, so we can compare and contrast the wash alone or the wash plus the lotion to understand what is maybe just happening naturally, what's evolving over time, and is the lotion doing something to assist the evolution, if you will. And so this is the comparison that really matters here. So here at baseline, there's no difference really between, statistically anyway, between wash and wash plus lotion. But if you start to look at 3 weeks, no change again. But at 4 weeks, there is a there's significantly more rich microbiome profiles in the infants who are using the wash plus lotion versus the wash. Remember, richness is increasing over time anyway. But if we now just compare wash plus lotion, the lotion is creating a richer environment. So again, this could be because the lotion is enhancing the hydration of the skin. It's altering the environment. It's keeping the barrier probably more hydrated, maybe in a lower pH. In this case, we didn't see lower pH, but it's keeping the skin healthy. In some instance, it's affecting the microbiome in some way, likely through environmental modulation. And so we see increases in richness. There was another study done a couple of years ago that found the same thing, that using an emollient, in this case it was in babies prone to develop atopic dermatitis, they also saw increase in richness and a trend in their case toward higher diversity as compared to no emollient use. So I think this is something that emollients are doing, and probably something we should continue to understand better, especially in infant skin, and how that is implicated in the development of the ecosystem over time.